Hi, Senator. So you mentioned about a National Health Commission. I'm curious to know your agenda on health, your full agenda on health. Can you take us through that a bit?
Well, you need to look at the Constitution to understand matters around health. To begin with, health is a division of functions between the national and county governments is in the fourth schedule. If you look at Part 1, Paragraph 23 and Paragraph 28, they define what remains with the national government. Matters policy remain with the national government, and is what they are calling the National Health Referral Facilities. National Health Referral Facilities then go to also remain with the national government. Now, when things were being unbundled to the ground, I think there was some confusion whereby the National Health Referral Facilities were equated to Kenyatta National Hospital and Moi Teaching and Referral Hospital in Eldoret. Prior to that, there was a system of hospitals that were called the National Health Referral Facilities. Why referral? Referral is because people are supposed to stay in their communities and not to fall sick. Once you fall sick and you need medical attention, then you are referred from the community into this system for clinical care. Now, clinical care began from the clinic on the ground and went up to through the various levels up to level 6, where the apex hospitals sat, or centers of excellence, like Kenyatta and Moi were centers of excellence. But also, not all centers of excellence are level 6 hospitals. You'll find, like, for mental health, you've got Metara National Hospital is a level 4. You get for skin disease, you have got Alupe Hospital in Busia is level 4. And for spinal cord injury, you have that Spinal Cord Injury Center in Hurlingham is a level 4 hospital. So there was a network of hospitals so that they could transfer, patients could move around without being tied to a certain area. Now, looks like when devolution came, that was done. And so what do? They ended up devolving the hospitals to the counties, except for the national hospitals. That has happened. Now, as they did that, there was the question of the human resource. How do you handle the human resource in health? And before the draft constitution went to Naivasha, they had a National Health Commission, almost like the TSC, taking care of the human resource needs of medical personnel, doctors, nurses, and what have you, so that they could be deployed from the center, the way teachers are deployed. But you go to a point whereby, in Naivasha again, they removed the commission, saying it could be established by parliament. They did not say it was unnecessary. They just said that there are too many commissions in the constitution. So this other commission, the National Health Service Commission or National Health Commission, could be established by an act of parliament. And for me, where I sit, I think that thing is necessary to be able to take charge of the needs of doctors. Training a doctor is something that takes a very long time. It doesn't end when somebody leaves a college. It continues into the working life of the doctor. So you'll find that if you are to restrict a doctor to a county with no chance of moving out to another county and stuff like that, it becomes very difficult for even these doctors to develop. Even for them to go and leave, for them to go on further studies, for them to do it, the county becomes a very small unit of managing doctors and the other medical personnel. So for me, the commission would be a tool worth trying out so that we can have them centrally deployed like teachers to various hospitals. Then they can do their service there. Their pay is pegged on the national budget. It's not part of the development funds. They don't have to go on the streets to look for pay. They don't have to do whatever. And alongside that, we also need to have a way of handling these people who offer strategic services so that they don't have to go on strike when they've got a labor dispute. There should be a mechanism for doing it. And they exist in very, very many dispensations across the world. So that's why I talked that you require to get the idea of this commission coming up. It will set standards, it will discipline doctors, it will deploy them, it will give them opportunities to grow, promotions, further studies, further experience, and things like those. And also, the other health workers will also equally benefit that way. And that's what I thought, that we should be able to look at the human resource and address it adequately. Because you'll find that some doctors now, you'll find in many hospitals now, are not manned by doctors. They are being manned by clinical officers and nurses, because counties cannot afford these doctors or things like those. So to me, I think it will be very, very important to relook at the question of the human resource in the medical sector, how it is to be managed, how it is to be hired, how it is to be deployed. Under my command or in my government, I would want to look at the question of the human resource in the medical sector and see that it is well managed to ensure that there is room for personal growth of the medical personnel at an individual level. There's room for proper experience. The salaries are adequate and are not delayed, and they are paid centrally, and the deployment is central so that a doctor can be deployed from Moyale to Turkana. He goes to Mombasa, he comes to Bondo, he goes to wherever, and that way he gains experience as or she gains experience as they moved around. They can go on leave, study leave, because the pool is big and they can cover up for each other. So, and other than just committing these people to counties where even getting promotions will be a problem, maybe going for further studies will be a problem. Salaries are a challenge. Counties get their money late. All these things are there. So it would need a proper relook at the question of whether you want also to devolve the human resource, or you want to retain them at the center as a responsibility that the national government should then provide to the counties and ensure that the doctors are adequately paid, they're well trained, and they get an opportunity to experience different challenges from different parts of the world, disease challenges from different parts of the world.